Hello, this is Group 23 presenting the mental health of city dwellers. I'd now like to introduce Marie Joel to talk about how the urban workplace affects city dwellers' mental health.
Hello, I'm Mridul and I'm going to be talking about the workplace. Now, due to technology, diverse jobs with a lot of flexibility have opened up due to technological advances. I'd like to talk using the example of GitLab, which is a technological company, and I'm quoting Carrie Miller, who's an employee, who in a video said that the key to working on the road is flexibility and resourcefulness. And this is because Carrie now is a motorbiker and she likes to travel around 40% of her time, but in order for her to have an income she needs to work. So with technology it's really freeing up her mind that she can do whatever she loves and also focus on her work. It's opened new possibilities for businesses and workers to operate in. For example, companies like Uber, Skip the Dishes, who are delivering food and offering cab services, they're offering so much employment and helping ease out a lot of mental stress people have when they don't have a job or additional sources of income. Next, cities receive increased measure of inter-business relationships that allow for more contact with individuals outside of immediate business. It also saves time spent commuting that can be spent on something the employee values, such as families or relatives or something else they value. It's opened up more opportunities with a greater level of communication for people, and that is also impacting their mental health in a more positive way. Next, I'd like to talk about the negatives as well. With the coronavirus pandemic, we've all been working from home, working remotely, which has led to a feeling of isolation and the lack of real connection because we're trapped with the same kind of people at home. And it's obviously causing isolation. Then your entire day is kind of unstructured, which is again a pain, because you wake up and your personal life and your work life has been mixed up terribly. And you have to, the best way is to sort of have a schedule, but in some cases it's really unstructured. Then quoting Mark Rackley, who's a psychologist, I'm saying that he says that people are lacking focus and energy day by day the more time they're spent working on their homes. And the second point is lifestyle changes, where constant technological use can maybe make you addicted to your checking your email or checking your Slack messages or something like that. So that is also a negative with respect to technology. So I think the only solution to this is to have a moderation, which means that technology should be used in a moderation. You can maybe set times to check your email or something like that. And then companies should move towards hybrid models where you can actually call your employees in on some days and maybe they decide that, and they can continue to work from home so that everyone's happy. Thank you.
Thank you, Marie Joel. And now Jason will talk about how community affects mental health for city dwellers.
Community has a profound impact on mental health in general. The three critical elements that community serves for improving mental health are belonging, support, and purpose. The availability of being in a group that individuals identify as being a part of allows them to step out of their comfort zones and feel appreciated for their unique qualities. Furthermore, having a community that can help individuals through difficult situations offer individuals safety and care. Lastly, the sense of contribution allows for not only personal growth, but for establishment of healthy society. Despite the aforementioned importance, major cities are losing the fundamental sense of community day by day. Due to the continued globalization, political, economic, and social restructuring, many cities and advanced economies have been faced with a significant loss in inclusive power, an increase in forms of exclusion and polarization. City of Toronto, for example, has become increasingly polarized in terms of income. The inner city neighborhoods that were relatively poor and disadvantaged in the 1970s have become gentrified, and the previously wealthy suburban areas have experienced major downgrading. In America, between 1970 and 2009, the proportions of families living either predominantly poor or predominantly affluent neighborhoods doubled from 15% to 33%. Those living in middle-income neighborhoods declined from 65% to 42% of all families. Segregation plays a significant role in determining access to resources such as education, employment, transportation, and healthcare, which are all associated with health outcomes. It is no surprise that segregation also has an effect on mental health as well. Living in a segregated area increases the likelihood of antidepressant medication by 19% and anxiolytic medication by 39%. Physical manifestation of segregation, community tensions, and a heightened sense of other impact mental health. Despite the massive urbanization and substantial increase in discoverability of different communities that a city has to offer, the ongoing socioeconomic gap within major cities limit diversification of communities for city dwellers, therefore putting mental health of those at risk.
That was great, Jason. Thank you very much. And now we'll hand it off to Tristan to talk about both creative resources as well as privacy available in urban centers.
Urban environments provide an inescapable landscape of cameras, people, and tracking technology. This environment creates a sense of constant monitoring and can lead many people into a feeling of constantly being watched. As humans' desire for privacy increases in an increasingly watchful society, the mental health of individuals can suffer if their privacy needs are not met. One instance where facial recognition technology is negatively affecting individuals is in Belgrade, Serbia. According to the human rights group SHARE, over 800 locations in the city are now being surveilled constantly by facial recognition cameras, which were installed without citizens' feedback or desire. From this rise in surveillance, concerns are raised over political misuse, data security concerns, and the transformation into a police state. As individuals begin to feel more restricted in their movements for fear of consequence, mental health will begin to suffer. The combined stress of constant surveillance and fear of having personal data leak can have detrimental results on individuals. Inversely, privacy in cities can be increased as individuals are able to rally together with actionable plans to increase privacy. This can include pressuring the government to reduce the number of CCTV cameras, increasing the conversation around what privacy invasions are occurring and how they can be rectified. Inversely, urban environments can create positive mental health impacts on the individuals through the use of technology and planning. Cities allow for opportunities all within a close proximity. For instance, businesses focus on providing new experiences and technology to individuals, such as gyms, art studios, music shops, and lessons. Schools and experiential businesses are found across urban environments. This access to experiential business allows individuals to pursue their passions without incurring large travel times or without having to worry about time management issues. In addition, new experiences found in the city often lead to new interactions with individuals and increase interpersonal relationships. This increase in relationships and opportunity to partake in new experiences leads to an increase in individuals' mental health. In addition to passions, there are key resources rarely available. For instance, urban environments, there exist many variations of the same resource. One source resource can be mental health professionals. In large cities, many different businesses and resources centered around improving mental health exist, allowing for more individuals to access these resources when required. In addition to health resources and professional resources are in higher abundance, such as job opportunities, financial assistance services, and available technology innovations. Finally, as seen in the interview with Tamar El-Darabi, information technology can be used to better meet the needs of city dwellers. One such way in which data can be used is in construction planning and designing sustainable city environments. These developments are hugely beneficial to individuals' mental health, such as sustainable green cities, which offer better living conditions to its residents.
Hello, my name is Thomas Burkett, and I'll be talking about how the urban environment affects mental health. The 20th century has seen a dramatic migration from farms to cities, altering historical environments. Recent studies in Denmark have shown a 40% increase in city dweller depression as well as anxiety. A lack of green space has been proven to be one of the leading factors, as shown in the figure on the bottom left. Plentiful parks reduce mental risks, but are disproportionately crowded for both people of color as well as people from low incomes. Urban lifestyles and architectures can also leave people more vulnerable to external stimulation, with loud noises increasing anxiety and artificial light promoting depression and a lack of sleep, as shown in the bottom right. However, new designs seek to combat urban mental health issues. Toronto Sidewalk Labs are experimenting with new shelters to bring social activities outside year-round. This will bring people into a positive environment filled with natural light. Biophilic design seeks to integrate green space into all areas of modern architecture. Just look at the bottom right. The workplace, grocery store, and home setting can all bring feelings of peace when properly planned this way. Brutalist steel and concrete buildings have dominated much of downtown life. However, the rising use of wood composites as a building material reduces cost and further blends buildings into the environment in a sustainable way. All right, and with me for a quick interview is Gloria Liu. Gloria, you recently had the opportunity to work either in Toronto or London. Why did you choose to work in London, Ontario?
So comparing to Toronto, in London, you can go out and get some green space and sunshine, and it's less noisy as Toronto.
Okay, thank you very much. I'd now like to hand things off to Charlie to talk about some of the mental health resources available in urban centers.
Information technology is changing the way city dwellers can access the resources necessary for mental well-being. There are even resources nowadays offering online counseling and therapy that are growing in popularity. They present cost-effective, highly accessible resources to those that may not have sought them out otherwise. One survey of 409 university students showed that approximately 35% of the participants would be likely to utilize the online services, but not the face-to-face counseling that was traditionally the method preferred by most professionals. There's often a stigma associated with mental health problems, and an individual living in the city may be deterred from entering a physical counseling center in the view of many passerby. Qualities inherent in resources offered through information technology can alleviate issues like this by eliminating the physical distance and offering some anonymity to those who would otherwise go untreated. One study found that cell phones and computers allowed greater linkage with social, medical, mental health, and employment resources. And another showed that these types of services can result in as much as a 50% reduction in depressive symptoms and a 57% decrease in anxiety symptoms after 4 months. Even small things like finding a park or a hiking trail have been made that much easier. However, there are detriments to these services being so accessible. Many of these online therapy companies are not run by psychologists, and many legal, privacy, and ethical issues may arise, such as different codes of conduct and commitment to do no harm between sites based in different regions. With such a wide and relatively unfiltered selection, a lot more care needs to be taken in selecting the appropriate resources, which someone struggling with mental illnesses may not have the freedom to consider. Additionally, individuals with more severe illnesses or addictions may need significantly more treatment than what digital therapy can provide, and even if a therapist is concerned about a patient's safety, it's much more difficult to determine the risk and send them the help they may need. Despite all this, the growing number of resources now available to the average city dweller has made taking the first step in improving our mental well-being that much easier.